A 71-year-old man named Gerald was doing exactly what he did every Tuesday morning, sitting at his kitchen table, finishing his second cup of coffee, listening to the radio. His wife Carol was in the next room folding laundry. And then, without pain, without a dramatic collapse, without any of the warning signs people see in movies, Gerald noticed something odd. The spoon in his right hand felt unusually heavy. He switched it to his left and thought nothing of it. 30 seconds later, he tried to call Carol's name and the word simply wasn't there. He opened his mouth and what came out wasn't language. It was noise, scrambled, hollow sound where a word used to be. He stood up to walk toward her and his right leg moved strangely, as though it belonged to someone else. He made it to the doorway. Carol turned around and saw his face. The right side had softened in a way a face should never soften, not with age, not with fatigue, but with absence. Something had gone quiet inside him, and it was visible from across the room. What happened in the next 90 seconds before the ambulance was called and the position Gerald was placed in on the floor of that hallway is what his neurologist later credited with preserving the function Gerald still has today. He did not take medication. He did not attempt to walk it off. Carol had learned something specific, something clinical, something most families are never told. And she acted on it immediately. I am Dr. Pablo. I have spent 18 years as a board-certified geriatrician specializing in cardiovascular and cerebrovascular health in adults over 60. I have sat with patients who recovered almost completely from strokes that should have been devastating, and I have sat with families trying to understand why their loved one did not. And the difference, the genuine, measurable, neurologically documented difference, is almost always the same. What happened in the minutes before the ambulance arrived? Today, I am going to give you two things. First, I am going to tell you exactly what is happening inside your brain during the earliest moments of a stroke. Not the simplified version, the real version, because you are an intelligent adult and you deserve accurate information. Second, I am going to walk you through the specific technique that modern neurovascular research shows can help preserve brain blood flow during those critical minutes before emergency care reaches you. And I want to be direct with you about something before we go any further. The most important point in this video, the one that surprises people the most and carries the most physiological weight, is not the one you are expecting. I will build toward it deliberately, because understanding why it works matters as much as knowing what to do. Let me start with what a stroke actually is, because most people carry a mental image of it that isn't accurate, and that inaccuracy costs time when time is the only currency that matters. Your brain consumes roughly 20% of your body's total oxygen supply every single minute. Despite representing only about 2% of your total body weight, it runs at full power continuously, and it has almost no reserve capacity. Unlike your muscles, which can briefly operate without oxygen, your brain cannot. Brain cells, neurons, begin to die within 4 to 6 minutes of losing their oxygen supply, and they do not regenerate the way muscle tissue does. When a neuron dies from oxygen deprivation, it is gone. The surrounding tissue either compensates or it doesn't. A stroke occurs when one of two things happens. Either a blood clot blocks an artery supplying the brain. This is called an ischemic stroke, and it accounts for roughly 87% of all strokes. Or a blood vessel ruptures and bleeds into brain tissue, which is a hemorrhagic stroke. In either case, a region of the brain is suddenly deprived of the oxygen it cannot function without, and the clock starts immediately. But here is the piece of this that most people never hear. A stroke rarely announces itself the way a heart attack does. There is usually no crushing pain, no dramatic single moment of collapse. What happens is subtler, and that subtlety is precisely what makes it dangerous. The early phase of an ischemic stroke, before the blockage is complete, before the tissue is fully compromised, often produces symptoms that feel almost dismissible. An arm that feels heavier than it should, a sentence that takes a half-second too long to form, a moment of double vision that resolves before you can even fully register it, balance that feels slightly off and then doesn't. These are not quirks of aging. These are not the result of standing up too quickly or being tired. These are distress signals from a brain that is fighting for oxygen, and they carry a clinical name that most patients over 60 have never been told by their doctor: transient ischemic attack, or TIA. A TIA is not a minor stroke. I want to say that clearly and without softening it. A TIA is your brain's emergency alarm. It means the circulatory system has already produced a clot significant enough to interrupt brain blood flow. The clot may have temporarily dissolved or shifted, which is why symptoms fade, but the underlying condition that created it has not resolved. Research published in the journal Stroke found that approximately 10 to 15% of people who experience a TIA will have a full ischemic stroke within 3 months, and nearly half of those strokes occur within the first 48 hours. The symptoms fading is not a sign that the danger has passed. It is a sign that the window has opened. Here is what makes this particularly difficult for adults in their 60s and 70s. Many of these early symptoms overlap with sensations that aging produces on its own. Lightheadedness when you stand. That is often orthostatic hypotension, a normal vascular response. Momentary confusion upon waking. That is normal. Occasional word retrieval difficulty during a fatiguing day. That is age-related cognitive slowing. But sudden inability to speak coherently while fully awake and alert, that is not aging. Sudden arm weakness on one side with no exertion, that is not aging. Sudden facial asymmetry that was not there moments before, that is an emergency. The line between normal and dangerous is not always obvious, but learning to recognize the difference is not complicated once someone explains it correctly. The warning signs your body sends in the minutes before a stroke fully establishes itself are these: sudden numbness or weakness on one side, specifically one side, arm, leg, or face. Not both sides, not generalized fatigue, but a one-sided interruption of sensation or motor function. Sudden difficulty speaking or understanding spoken words, not searching for a name, but genuine loss of language where words either won't come or won't make sense. Sudden vision changes, blurring, loss of vision in one eye, double vision appearing without any physical cause, sudden severe imbalance or dizziness, not the brief unsteadiness of standing too fast, but persistent loss of coordination affecting walking or spatial orientation. And finally, a sudden severe headache that is unlike any previous headache. Neurologists sometimes describe this as the worst headache of the patient's life, appearing without warning. These symptoms can last 60 seconds and disappear. And when they disappear, the most dangerous thing that can happen is that the person decides they were nothing. Gerald, in the moment his symptoms began, did not decide they were nothing. His wife did not allow it. And what she did next is what I want to walk you through in detail, because this technique is not folklore and it is not internet medicine. It is rooted in the physiology of cerebral perfusion pressure, and understanding even the basic version of that physiology will change how you respond if this moment ever arrives in your home. The brain receives its blood supply through 4 major arteries, 2 carotid arteries in the front of the neck, and 2 vertebral arteries in the back. Blood pressure within the skull is measured as cerebral perfusion pressure, and it is the difference between the mean arterial pressure driving blood into the brain and the intracranial pressure pushing back against it. When a blockage reduces blood flow, that perfusion pressure drops in the affected region. The surrounding tissue, what neurologists call the ischemic penumbra, is not yet dead. It is injured, struggling, operating below capacity, but it is still alive. And for a window of time that is measured in minutes, it can be preserved. Gravity is one of the fastest tools available to influence cerebral perfusion without medication, and this is the core of what Carol did for Gerald. The moment she recognized his symptoms, she did not help him to a chair. She helped him to the floor, flat on his back. And she elevated his legs, using the arm of their couch, stacking them against the wall, to approximately 12 inches above the level of his heart. This position, called the Trendelenburg adjacent supine position in clinical literature, uses gravity to redirect blood pooled in the lower extremities back toward the central circulation, increasing venous return to the heart and improving the volume of oxygenated blood the heart can then pump upward toward the brain. In a moment when every milliliter of cerebral blood flow counts, this positional shift can meaningfully alter perfusion in the penumbral tissue that is not yet dead. A study published in 2018 in the journal Neurology examined outcomes in patients with ischemic strokes who were maintained in a lying flat position versus a sitting up position during the acute pre-hospital phase. The lying flat group showed measurably better cerebral blood flow velocity on transcranial Doppler imaging and trended toward better neurological outcomes at 7 days. This is not theoretical. This has been measured in human patients during actual stroke events. But positioning alone is only part of the intervention. The second component is controlled breathing, and this is the point in this video I told you I was building toward, because most people, when they imagine responding to a stroke emergency, imagine action, movement, doing something, and I am about to tell you that one of the most powerful things you can do is breathe in a very specific way, and I want you to understand exactly why. During a perceived emergency, the sympathetic nervous system activates immediately. Adrenaline floods the system, heart rate accelerates, breathing becomes rapid and shallow, blood vessels in the extremities constrict. And here is the problem. During an ischemic stroke, vasoconstriction is dangerous. Tightened blood vessels reduce the diameter through which blood must travel to reach compromised brain tissue. Rapid, shallow breathing reduces blood carbon dioxide levels faster than the body can compensate, causing cerebral vasoconstriction through a reflex mechanism. You are, in effect, physically narrowing the pathways that injured brain tissue is depending on. Controlled slow breathing reverses this. Inhaling through the nose for 4 seconds, pausing for 2, exhaling through the mouth for 6 seconds. This specific ratio activates the parasympathetic nervous system, reduces sympathetic vasoconstriction, and restores blood carbon dioxide to levels that support cerebral vasodilation. The vessels relax, blood moves more freely, the penumbra receives more oxygen, and critically, the patient remains calm enough to remember when symptoms began, to communicate with arriving paramedics, to not injure themselves in a fall, and to stay horizontal in the position that is physiologically protecting them. Carol held Gerald's hand on that hallway floor and breathed with him. She counted the seconds out loud. In for 4, hold for 2, out for 6. By the time the paramedics arrived, Gerald's speech had partially returned. His neurologist told them later that the imaging showed evidence of penumbral tissue that survived. Tissue that, in the neurologist's clinical judgment, had received enough residual blood flow during the pre-hospital period to avoid the irreversible injury that would have ended Gerald's ability to speak permanently. I want to pause here and ask you something. If you are over 60 and the person you love most is sitting in the next room right now, do they know what you just learned? Do they know the difference between a TIA and normal aging symptoms? Do they know the position to put you in, the breathing pattern to guide you through, the specific reason why lying flat is not instinct but is biology? Because most people don't. And that gap between what medical research has established and what families actually know is not a failure of intelligence. It is a failure of communication. It is the reason I make these videos. Now I want to talk about something that matters not just in the moment of crisis but in the months and years surrounding it. And this is the part that most stroke content skips over almost entirely: recovery. And specifically what the research now tells us about the aging brain's capacity to rebuild itself. Neuroplasticity, the brain's ability to form new connections and reroute function around damaged tissue, does not stop at 60. It does not stop at 70. The rate slows, yes. The process requires more intentional input, more repetition, more patience. But it continues. And this matters enormously for anyone who has experienced a TIA, a minor stroke, or who is caring for someone in recovery. The first 48 hours after an ischemic stroke are the window most clinicians focus on. Tissue plasminogen activator, or TPA, must be administered within a specific time frame to dissolve the clot. Mechanical thrombectomy, physically removing the clot using a catheter, has a longer window, up to 24 hours in selected patients. This is why the pre-hospital phase matters so much. Every minute you preserve penumbral tissue through positioning and breathing is a minute more of viable brain waiting for those interventions. But recovery extends far beyond those first hours. I have watched patients regain speech 6 months after a stroke. I have watched patients relearn to walk 8 months after an event that left them unable to feel their left leg. This is not exceptional. This is what a brain that is consistently stimulated, nourished, and given repetitive input will do. What the research now confirms, including a landmark study from the University of Southern California tracking stroke survivors for 2 years, is that patients who engage in consistent low-intensity daily movement, controlled breathing practices, and targeted nutritional support show neurological recovery outcomes roughly twice as strong as those who do not. Twice. Not marginally better. Twice. What does that daily movement look like in practice for someone over 60? It does not look like a gym. It looks like this. Within the first weeks of recovery, seated gentle movement is both safe and neurologically productive. Slowly opening and closing the hand on the affected side, rotating the ankle, tilting the head gently side to side. These small, repetitive movements send afferent signals traveling from the body back to the brain that stimulate the surviving neurons surrounding the damaged area and encourage them to begin accepting new functional assignments. The brain recognizes the signal. Use it and it strengthens. Ignore it and the window narrows. Hydration during recovery is something almost no one discusses, and it is a failure of stroke medicine's communication with patients. Blood viscosity, how thick your blood is, directly affects how freely it moves through narrowed or recovering cerebrovascular pathways. Dehydration, even mild dehydration, increases blood viscosity measurably. A study published in the American Journal of Clinical Nutrition found that adults over 65 who maintained consistent daily fluid intake of at least 6 to 8 cups of water had demonstrably lower blood viscosity markers and lower rates of secondary stroke compared to matched peers who did not. A glass of water in the morning before coffee is not a wellness cliché. It is a cardiovascular intervention. Nutrition shapes recovery and prevention with a specificity that most people have never been given. Omega-3 fatty acids, found in fatty fish like salmon, mackerel, and sardines, reduce systemic inflammation and support the lipid composition of neuronal cell membranes, literally improving the structural health of brain cells. Leafy dark greens, spinach, kale, arugula, are rich in dietary nitrates that the body converts to nitric oxide, a molecule that causes arterial smooth muscle to relax, reducing peripheral resistance and allowing blood to flow more freely through cerebrovascular pathways. Berries, blueberries, blackberries, strawberries, contain flavonoids that a 2020 study in neurology linked to a significantly slower rate of cognitive decline in older adults, with the greatest effects seen in those who consumed them consistently over 5 years or more. And here is the point that is entirely absent from most stroke prevention content. Something I have observed across 18 years of clinical practice and that research is now beginning to formalize. Chronic psychological stress is a direct cerebrovascular risk factor, not a background variable, not a lifestyle consideration, a direct risk factor. Sustained elevation of cortisol, the body's primary stress hormone, promotes arterial inflammation, accelerates the formation of atherosclerotic plaques in the carotid arteries, and increases platelet aggregation, meaning it makes your blood more prone to clotting. The very mechanism of ischemic stroke. Patients who experience chronically high stress levels without effective management have measurably greater carotid intima media thickness, a clinical marker of arterial disease, than age-matched peers with lower stress burden. This is why I ask every patient over 60 about sleep, about social connection, about whether they have people in their lives who bring them genuine peace. These are not soft questions. They are cardiovascular questions. Sleep is the period during which the glymphatic system, the brain's waste clearance network, operates at full capacity, flushing inflammatory metabolites from neural tissue. Interrupting that process night after night, through poor sleep quality or duration under 6 hours, allows those metabolites to accumulate. Over years, that accumulation contributes directly to both stroke risk and cognitive decline. So when I tell you to protect your sleep, I am not offering lifestyle advice. I am telling you to protect your brain's only cleaning cycle. Now I want to share something about Thomas. Thomas was a 68-year-old retired contractor who came to see me after a TIA that had lasted approximately 90 seconds and left him with no lasting symptoms. His wife had insisted he come. He told me, with the calm matter-of-factness of a man who had spent 40 years working through discomfort, that he thought it had probably been nothing. His carotid ultrasound showed 64% stenosis on the left side. His LDL was elevated, his sleep averaged 5 hours, and he had been under sustained financial stress for 2 years following a difficult retirement transition. He had every major modifiable risk factor. We changed his medication regimen, restructured his nutrition, addressed his sleep with specific guidance, and I taught him and his wife the positioning and breathing technique. I asked him to come back in 6 months. He came back in 4. Not because something had gone wrong, because he wanted to tell me that his wife had used the technique. He had woken one morning with right-sided facial numbness and slurred speech. She put him on the floor, elevated his legs, and breathed with him while she called emergency services. His imaging showed a small area of ischemic injury, but the surrounding penumbral tissue was intact. His speech returned fully within 24 hours. His neurologist used the same language Gerald's neurologist had used. What happened in the pre-hospital period mattered. Thomas still comes to see me. He is 72 now, and he volunteers at a senior center twice a week. He has taught the technique to 11 people. If you are watching this right now, and I would genuinely like to know who you are, write your age and where in the world you are watching from in the comments below. I read them. The range of places people watch from always moves me, and it reminds me why this work matters. Now, let me give you a practical morning routine built around cerebrovascular protection, because prevention is where the most leverage exists. Before you stand up in the morning, before your feet touch the floor, sit on the edge of your bed and take 3 slow, complete breaths. Fully expand your lungs. This reoxygenates your blood after the relative hypoventilation of sleep and stabilizes your blood pressure before you introduce the postural change of standing. Then spend 60 seconds pumping your calves, lifting your heels and toes in a steady alternating rhythm. The soleus muscle in the calf is sometimes called the peripheral heart because its rhythmic contraction physically pumps venous blood upward through one-way valves in the leg veins back toward the central circulation. This is not metaphor. This is anatomy. Activating it before you stand reduces the pooling of blood in the lower extremities that contributes to morning orthostatic drops in blood pressure. Drops that in vulnerable cerebrovascular systems can briefly reduce brain perfusion. Then drink water before anything else. Before coffee, before breakfast, before your phone, a full glass. You have been fasting for 7 or 8 hours and your blood is measurably more viscous than it will be 2 hours from now. Thinning it with water before you ask your cardiovascular system to handle the demands of a morning is a small act with a meaningful physiological effect. Add 5 minutes of gentle neck and shoulder rotation, slow, deliberate, not strenuous, to support blood flow through the carotid and vertebral arteries. If you experience any dizziness during neck rotation, stop immediately and speak to your physician, as this can be a sign of vertebrobasilar sensitivity. Otherwise, this routine takes 12 minutes from the moment you sit up to the moment you walk to the kitchen. 12 minutes that signal your cardiovascular system, your cerebrovascular system, and your brain that the day is beginning with intention. And in the evening, before sleep, return to the controlled breathing. 4 seconds in through the nose, 2-second hold, 6 seconds out through the mouth. 10 repetitions. This activates the vagal brake on your heart rate, lowers nocturnal blood pressure, and prepares the glymphatic system for the clearance work it will do while you sleep. It takes less than 2 minutes, and over weeks, the cumulative effect on autonomic nervous system regulation is measurable. Let me bring this back to where we began. Gerald on the floor of his hallway, Carol breathing with him, counting seconds, keeping him calm and flat and still until the paramedics arrived. That moment was not luck, it was not instinct. It was knowledge, applied under pressure, in the right sequence. The paramedics who arrived said he was one of the calmest acute stroke patients they had encountered in the pre-hospital phase. Gerald told them he was breathing on purpose. He is 75 now. He plays cards on Thursday evenings with a group of men he has known for 30 years. His speech is clear. His right hand, which had gone functionally silent that Tuesday morning, works well enough that he still does his own woodworking. That is what preparation looks like when it works. I do not want you to live in fear of what your body might do. I want you to live with the quiet confidence of someone who knows exactly what to do if it does. Aging is not a surrender. It is an accumulation of knowledge, of awareness, of the hard-won wisdom to take your body seriously before it demands that you do. If this reached someone today who needed it, share it with one person, a spouse, a sibling, a neighbor who lives alone. You do not need to explain stroke medicine. You only need to say, watch this, it could matter. Because the goal of everything I do here is simple. I want the people I never get to see in a clinic to have the same information that the patients who sit across from me do. You deserve that. Every one of you. Stay aware. Stay calm. And when the moment comes, lie flat, elevate the legs, breathe slowly, and let the biology work in your favor.